Okay, Australians are urging the federal government to fund a life-saving vaccine to help prevent a dominant and potentially deadly strain of meningococcal disease. Let's bring in today medical expert Dr. Nick Coatsworth live in Canberra. Nick, thanks for joining us, mate. Can you tell us about this particular strain?
Yeah, I can, Whipper. Meningococcal disease, one of the most feared infectious diseases, comes in several different strains. The one we're vaccinated against, there's four, A, C, W and Y, but meningococcal B, we don't have publicly funded vaccination for, Whipper, and that's what people are calling for. The challenge here is that you need a completely different vaccine for meningococcal B than you do for the other four strains, and it's not quite as effective, and it doesn't give you as much herd immunity as the other vaccine for the other strains. So it's a big debate in public health circles. But of course, if you've got a family member or a teenager who's ever suffered or indeed lost their lives from this, then no amount of money would be too much, Whipper, would it, to cover for this eventuality.
It's a bit scary, Dr. Nick. Most people are vaccinated for meningococcal before their adult years, but can they still be at risk?
Yeah, well, look, they certainly can later on. The thing is that if you've been vaccinated for the strains A, C, W or Y, that vaccine is fairly protective over time. If you can afford the vaccine for meningococcal B, which is about $122, your immunity will be sustained. It may wane over time, but you won't be as affected. I mean, I think the problem is that we're talking about a disease that affects largely 15 to 24-year-olds and people at the prime of their lives with no underlying medical conditions. And whilst rare in Australia, it is certainly during my career as a doctor, it's always been the most feared infectious disease because of that very reason, that it can strike down very well teenagers and young adults.
There's also concerns for a new mutant flu strain with the number of recorded cases 5 times higher than this time last year.
Well, it's certainly happening. I mean, I was at work at Canberra Hospital yesterday doing the Sunday shift, and we had a couple of our young doctors who were off with the flu. This does happen from time to time. You can get a slight change, a mutation in the virus during the year, and suddenly you've got a summer surge of influenza, which is slightly unusual, but certainly happening now. So a bit of an increased burden on the health system and a worry when we're around our elderly relatives over the Christmas and holiday season.
Dr. Nick Coatsworth, thanks for joining us, mate.
Thanks, Whip.